Many people ask, how exactly does someone die of cancer? This simple question often raises confusion and fear. We hear the terms end-stage or terminal cancer, but few truly understand what happens in the human body. The first thing to emphasize is that not everyone with cancer dies. Advances in modern medicines, as surgery, chemotherapy, radiation, hormone therapy, and immunotherapy, have saved millions of lives. However, when cancer reaches the terminal stage, when all therapies are no longer effective, the body begins to show characteristic signs of decline. And here, we will discuss the process. What actually happens? How does the body slowly stop working? What really causes a patient to die? And how can families and healthcare providers help? The difference between chronic and acute patients in the world of hospice or end-of-life care. There are two broad patterns of patients. Chronic illnesses, for example, dementia, Alzheimer's, heart failure, or Parkinson's progress slowly, often over 10 to 15 years. The decline is like descending a flight of stairs. Acute illness, usually in terminal cancer patients, the process is quicker, sometimes only a few months after the final diagnosis. The decline is steeper and more dramatic. This is why cancer patients often enter hospice within a shorter time than patients with chronic illnesses. However, early admission can significantly improve their quality of life. Hospice isn't just about dying, but about living comfortably until the end. In fact, several studies have shown that cancer patients who enter hospice actually live longer than those who continue to undergo invasive therapies in the final stages. What happens inside the body? Cancer is essentially abnormal cells that grow uncontrollably. If it affects vital organs, the lungs, liver, kidneys, brain, or bones, the body's functions begin to collapse. If cancer attacks the liver, metabolism is disrupted, toxins accumulate, and fluid accumulates in the abdomen. If cancer attacks the lungs, the patient experiences shortness of breath, coughing up blood, and lack of oxygen. If cancer attacks the brain, confusion, behavioral changes, and even seizures occur. If cancer spreads to the bones, the patient can experience severe pain and fragility, leading to fractures. However, although the direct causes differ, the pattern of death is nearly the same. The body can no longer maintain balance, organs fail, and vital systems slowly cease to function. Early signs of the end. Terminal cancer patients usually exhibit typical symptoms near the end. Sleeping more, the body seems to go into energy-saving mode. Decreased appetite, not due to forced starvation, but rather the body actually turning off hunger and thirst signals. Dramatic weight loss, muscle weakness, decreased energy, decreased level of consciousness. Patients are more often confused and have difficulty focusing. At this stage, families often panic when they see the patient not eating or drinking. However, the patient stops eating not because they want to die, but because their body is preparing to die. Administering excessive fluids is dangerous. Fluids can leak into the tissues, causing swelling and shortness of breath. Why it's not the same as dying of starvation? There's a common misconception. Families assume patients die of hunger or thirst. In fact, the truth is the opposite. They don't eat or drink because they're actually dying. The dying body has natural mechanisms, reducing hunger and thirst, releasing ketones, which can actually calm and reduce pain, encouraging patients to sleep more, thus reducing suffering. This is what's called the body's wisdom. It's natural, and it's the body's way of providing a more peaceful end. The role of hospice and palliative care. This is where the role of hospice becomes crucial. The hospice team focuses on reducing pain with specialized medications, treating shortness of breath with oxygen therapy or breathing techniques, reducing nausea, anxiety, or insomnia, providing psychological and spiritual support to patients and families. Hospice is not a place to give up. Hospice is a place to live with dignity until the last moment. Many families, initially skeptical, are ultimately grateful that the patient can pass away peacefully without unbearable pain. Gradual, functional decline. The journey of a terminal cancer patient in hospice generally follows this pattern. Early stage, still able to walk with assistance, eat a little, and talk with family. Several months later, increasingly weak, needing help bathing and dressing, eating only a few bites, sleeping more. Toward the end, most of the time in bed, rarely conscious, completely dependent on the care of others. At this stage, the family plays a crucial role, not to rescue with medical means, but to maintain comfort and togetherness. When the body truly shuts down in the final weeks or days, the signs become more obvious. Breathing slows, sometimes stopping briefly. Blood pressure drops. Pale skin or bluish discoloration of the fingertips. Consciousness almost completely disappears. And finally, the heart stops beating. This is the moment families dread most, but it can also be a peaceful one if the patient is cared for compassionately. A peaceful death. So, how does someone truly die of cancer? The answer: not from starvation or thirst, but because cancer damages vital organs to the point where the body no longer functions. This process is almost always gradual, with recognizable signs. But most importantly, dying from cancer doesn't always mean prolonged suffering. With proper palliative care, many patients die peacefully, without undue pain, surrounded by their loved ones. Death, after all, is a part of life, and understanding this process is not to scare us, but rather to allow us to accompany it with love and accept that the human body knows how to end its journey peacefully.